Hi, and welcome back to Lourie Medicare Essentials. Today, we're diving into Medicare choices. We'll cover the differences between Medicare Advantage and Medicare Supplement plans, and also revisit Original Medicare. By the end of this video, you'll know exactly how to explain these options to your clients, so whenever they are new to Medicare, you can help them navigate the complexities with ease. Let's jump into it. So, how do you explain Medicare options to your clients? As you know, Medicare is very complex and is full of a bunch of different parts. It can be extremely confusing for beneficiaries new to the system, and it's your job to empower your clients to understand their coverage options so they can make the best decision possible. At the top here, you have Original Medicare A and B. Part A is the hospital coverage, and Part B is your medical coverage. Most people pay no premium for Part A as long as they've worked at least 10 years and paid into the payroll system for 40 quarters. If your clients have not met those requirements, they will have to pay a premium for Part A, and if you want to learn more, check out our Part A video that's on our Agent Partner Hub. Moving over to Part B, it does have a monthly premium. The only way the clients get around paying this monthly premium is if they qualify for Medicaid, in which the state would pay it for them. So Part B in 2025 costs $185 a month, and that is the base premium, meaning certain individuals of higher incomes might have to pay more. If you want to learn more about those monthly adjustments, you can check out our Part B video, which is also on our Agent Partner Hub. It's great that we get Original Medicare A and B from the government and Social Security, but by itself, it's really not enough coverage. There's two big reasons why. Under Part A, if your client only had Original Medicare and nothing else, they would be faced with a $1,676 deductible if they were to be admitted to the hospital. This is actually only per benefit period, which is 60 days. So if your client went to the hospital and then had to go back 3 or 4 months later, they'd actually have to pay that again. So a few different trips spaced out at the right time increments could end up in a large bill. Moving over to Part B, after a small deductible of $257, which is annual, so not a big deal there, the big problem is your clients would have an unlimited 20% coinsurance for all covered services. 80/20 is normally pretty good coverage, but the issue here is the 20% has no limit of what Medicare will let your clients spend. An example would be a $100,000 bill that is very realistic for Medicare would be billed at $20,000 to your clients, and you don't want that to happen. That is where you come in as the agent down here at the bottom. You offer either Medicare supplements or Medicare Advantage plans through private insurance companies that can help lower and limit your client's exposure as they use the coverage. The first option is a Medicare supplement plan along with a Part D drug plan. These plans act as a secondary to Medicare, meaning Original Medicare A and B pays first, the supplement comes in and pays second. They typically start out at age 65, somewhere between $100 and $150 a month, and that premium is in addition to the Medicare Part B. That premium also increases a little bit each year with age and rate increases as medical expenses climb, but there are some pretty big pros to having a Medicare supplement plan. The first is there's no network restrictions. Since these plans act as a secondary to Original Medicare, your clients will be able to see any doctor in America that takes Medicare A and B. Also, these plans feature low or no cost sharing for hospital and medical coverage, meaning your clients will have very little out-of-pocket costs as they use the plans. Now, these plans do only cover what Original Medicare covers, so they don't give any additional benefits like dental, hearing, vision, or gym memberships, and they don't include drug coverage either, so your clients would have to purchase all that separately. At a minimum, your clients will definitely want to get a Part D prescription drug plan so they won't be penalized in the future for picking it up later, and so they have some coverage for their medications at the pharmacy. These plans are also offered through private insurance companies, typically have a set monthly premium, and cost sharing at the pharmacy. If you want to learn more about Medicare Part D, check out our Part D video on our Agent Partner Hub as we go into a lot more detail. So, switching gears over to option 2, we have Medicare Advantage plans, which are also referred to as Part C. When your client chooses a Medicare Advantage plan, that plan becomes primary over original Medicare. The easiest way to think about it is they're still getting their Medicare, they're just getting it administered through a private insurance company. These plans feature low or no monthly premiums. They're copay and coinsurance style plans, meaning your clients pay a portion of the cost as they use the coverage. However, they are network based as well, meaning your client needs to stay in network to get either the lowest cost sharing or, in some cases, coverage at all. Typically, plans are PPO or HMO plans, and if you want to learn more about specific networks and how that functions, make sure to check out our Medicare Advantage video on the Hub. Medicare Advantage plans also include additional benefits that Medicare supplements do not, like dental, hearing, vision. Sometimes they offer gym memberships, and even lately, grocery cards. Most also include Part D coverage, meaning your client doesn't necessarily have to go get a separate Part D plan, as it's most of the time is included in their Medicare Advantage. There are two types of Medicare Advantage plans, MAPDs and MA-onlys. So if your client wants prescription drug coverage, make sure you look at an MAPD, which stands for Medicare Advantage with prescription drug. These plans also, since they are primary over Medicare, they do sometimes feature a little bit stricter prior authorizations since the private insurance company is approving certain services, not Medicare. So keep that in mind and make sure your clients are aware when you're going over these two options. So to summarize option 1 versus option 2, option 1 is a Medicare supplement and then they get a separate prescription plan. These plans feature a higher monthly premium than option 2 because they have to pay an additional premium for the supplement and an additional premium for the drug plan. Because of that, though, they have low or no cost sharing medically and no network restrictions when they use their hospital and medical coverage throughout the country. Pretty good pros there, great coverage, but more expensive. Option 2 is a Medicare Advantage plan. These plans feature low or no monthly premiums in addition to Part B, but because of that, your client does have a higher cost sharing and they are network based, so your client needs to stay in network. One more thing before I let you go. When someone's new to Medicare, they can get either of these options with no health questions. Once they've been on Medicare for a while, if they want to get a Medicare supplement and they don't already have one, they will have to pass through underwriting and answer health questions unless they have a trial period or a guaranteed issue right. If you want to learn more about the specifics of those, check out our Medicare supplement video. Medicare Advantage plans never ask health questions. Your client just has to have a valid election period to be able to enroll. So, in this example, if your client starts with a Medicare supplement and they later want to switch to a Medicare Advantage plan, they can never be denied coverage. But if they start with a Medicare Advantage plan and want to switch over to a Medicare supplement, they could be denied due to pre-existing conditions. Make sure you are talking about those or talking about that whenever you're going through these options, as many people think you can switch back and forth with no health questions during annual enrollment. There you have it. That is how you explain Medicare options to your clients in the most unbiased way possible. Remember, your job isn't to sway your clients one way or the other, but rather to empower them to make the best decision about their health insurance as they can. To stay up to date with all the ins and outs of everything health insurance and Medicare, make sure to check out the rest of our Lourie Essential series, which can be found on our Agent Partner Hub.